Your teenage child has been just diagnosed with functional neurological disorder, short for FND, or has been struggling with FND condition for a while but didn't get the diagnosis until recently, or your child has been struggling with FND and have known it as FND but didn't really know how to resolve FND, then I might be potentially able to help you. Because many families are curious about my online program, Teen FND Academy, and I'm here to answer some of the very common questions that I am being asked all the time. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. First of all, if you found this video, I'm so glad you're here. And I can only imagine how frustrated and devastated you would be feeling about your teen struggling with FND. So let's start with what is FND. It is an umbrella term to describe this cross-wired problem between the brain and the body, even though your teen's brain and body are structurally and physiologically quote-unquote fine. It is a real diagnosis, I know, because that's my specialty. And oddly, it is a very common diagnosis you would get in neurology clinic, even though you feel like you're only one on the planet who is going through this. And FND is a biopsychosocial phenomenon. And teen FND, you're in luck because the odds of you resolving FND is really, really high compared to adults who are struggling with FND. And again, statistically speaking, the sooner you start the healing journey or treatment, the odds of you resolving FND is really, really high. And I keep talking about this on my YouTube channel. As long as you take the right approach, then you are likely to get better. And some families have been asking me what is the right approach and how I actually help teens to resolve FND. So let me talk you through what Teen FND Academy is. But before that, let me clarify, when I say right approach, it doesn't necessarily mean that you have to find the silver bullet treatment. The right approach is really depending upon your child's situation, what's going on with their family, and what are the other things that's going on. So it is not a one size fits all. So it's not like that there is this right approach floating around and it's your job to figure out what that right approach is. Because many families I work with, that right approach is not only working with me, but also working with physical therapy, occupational therapy, and other therapists, right? And while other families, their right approach might be to be in a hospital setting, in inpatient setting. And I don't have an inpatient program, so I'm not saying that my approach is the right approach. So I just want to clarify that. So that being said, what is Teen FND Academy? Teen FND Academy is an online education group coaching program to help teens between the ages of 12 and 18 struggling with FND, among other things, and their parents learn the practical skills and strategies to help resolve FND. It has 3 components to it, and in the program right now, I'm running for 6 months, and both teen and parents have to be in the program together. So it's the parent-teen dyad, or more like a team approach program. And so the 3 components are the 3 C's. One is the curriculum. It is a pre-recorded mini lessons across 10 modules or 10 steps for both teens and parents. And it's a step-by-step roadmap of exactly what to do to resolve FND. Number 2, the second C is a coaching part. It is a meeting with both teens and then parents separately every week right now for Q&A. And this is really the time for each family to get the live coaching tailored to their own unique situation at the time, really to get the pinpoint coaching and support. And also, this is a time to learn from each other who are arguably going through the same thing. And so this is where a lot of parents and teens feel like, oh, wow, we're not the only one who is going through this. And in fact, there are so many others who are going through the same journey, so they feel extremely supported. And speaking of extreme support, the third C, the third component, is a community. And I do have teens and parents a separate community forum that are private for ongoing support and coaching. So in that setting, they would get to ask questions and share their wins, whether it's a small or big, and support each other. And I'm available as well through chat and DM, where these families are getting ongoing support throughout the whole program. So you're not really walking through this of what to do, how to do, and why this is happening alone. So what's actually in the curriculum? This is something I get asked a lot of questions about too. So across the 10 modules, I had to just look at my notes here. So across the 10 modules, there are 3 sections, which is what, how, and why in that particular order. So the what part is really what is FND. And I talk about the biopsychosocial phenomenon, as I talk about here a lot, and the 3 Ps, and knowing how FND happens and stay in the system, and then how FND and other symptoms go together. Because after all, FND is really the dysfunction of autonomic nervous system, and then really it's a mind-body problem, right? Because the mind and body are all connected. And therefore, with FND, there are so many other things that are potentially going on at the same time, such as chronic pain, fibromyalgia, EDS, POTS, anxiety, panic attack, all of these things. So I explain how they go together, right? And then there's a lot of brain science to it, and why parents must be involved for this program to work, because there is reason. And I say this over and over again. Parents, you are not the problem. In fact, you are the solution. But you kind of need to know what you need to do and what your role would be. Because the recovery for FND isn't necessarily about using your own motherly, fatherly instinct. It is actually a lot of counterintuitive methodologies, but you have to go through that towards resolving FND. So anyway, at the end of this one giant what part, we always end with goal setting, because the goal setting is really important. And I have another video talking about why goal setting is important for both teens and the parents. And this is using the GPS model. Conveniently, it has a name for it, the goal and the purpose, why this goal is important, and what kind of system and steps you're willing to take. So that's the first part of it. The second part of it is the how. That's the chunk of it. This is the meat of the program. And it really starting with the mindset, then rebalancing the autonomic nervous system, right? Both soothing and uplifting strategies. So it's not just the relaxation strategies. And then we talk about FND sequencing. So knowing the triggers, knowing the warning signs, and all to increase the self-awareness and the self-control, because those are the 2 absolute ingredients you have to have if you want to resolve FND. Then talk about chronic pain and how to manage the symptoms through different strategies. Then activity pacing and a 4-week return to life plan. Then back to school plan, including brain fog, what to do with it. We also talk about what is accommodation, including 504 and IEP, and what is an individualized healthcare plan. Obviously, we talk about FND action plan that we talked about here on this channel, and who to talk to and what to say, including scripts of what teens can say and what parents can say, and then who they can talk to. Then of course we talk about relapse prevention in the name of creating a coping kit. And then we talk about sleep protocol as well, because many teens who are struggling with FND also have a lot of problems with sleep. Then we're getting into the why. And this is finally where I start talking about the cognitive behavior techniques and strategies, including thoughts and feelings and actions and stuff. And I specifically have this ABC step, being aware and being the judge of your own thoughts, not being judgmental of yourself, but being the judge of your thought and challenging what is not working or change what is not working. And expressive writing exercise is something that I love doing, the value cards game, and etc. etc. So this is where I talk a lot about cognitive behavioral technique and strategies. That is not the first thing that we do, because if your teen is struggling with FND symptoms or episodes or constant something within the realm of FND, then your teen really needs to have a bottom-up approach and be able to get their life back, and also be able to rebalance the autonomic nervous system before they approach these top-down things. So that's why I designed the program in that particular order. Then we talk about the communication, which is being assertive and how to express yourself, and etc., etc. And throughout the program, the parenting strategies are all embedded at every single step. So then not only that they're learning what teens are supposed to be doing, they are also learning what they're supposed to be doing as well. And what is not Teen FND Academy is, even though I am a licensed clinical psychologist specializing in working with the kids and teens, medical conditions, and have helped thousands of patients overcome their challenges related to those medical conditions. However, in this program, I am acting as a coach. So Teen FND Academy is not a treatment or a therapy. This is not a family therapy, so you don't really need or require to sort of spill the gut, but you have to work towards regaining the control of your brain and the body. So this is really about the educational and coaching program. Therefore, weekly calls are for Q&A, education specifically, and coaching. So it is not a group therapy, and it is strictly coaching. So what is the difference between treatment and this coaching? In the treatment, what I would do in my private practice, is I would assess your family situation in depth and then give you a diagnosis. And then I would come up with a treatment plan and then treat you. This can also include coordinating care with school and other providers and whatnot. And these days, I am shrinking down my private practice because I am so focusing on growing my online program. But that's essentially what I do. In coaching, though, I would not do any assessment or any diagnosis, even though clinically I am definitely capable of doing that. But really, it's about coaching. So I will teach you very much solution-focused oriented and give a step-by-step directions and coaching and guidance. And you are not my patients because of that. You are my students. And what is not the Teen FND Academy is obviously because it requires you and your team to learn the skills and practice those skills and strategies. It is not a quick fix magic pill, or it's like a massage therapy. You just go and then all you do is lay down and then somebody is doing things to you or for you. Right? And also it is not a conventional medical model. Therefore, it's an education program. Therefore, there's no treatment. Therefore, there's no insurance coverage. Although I have found some families using HSA and FSA accounts, so make sure to check with your employers if you want to. But really, I am here to guide you and coach you on how to get better and get your life back. So I cannot fix this for you because you and your team need to work for it. Okay. And I also get asked this question: what if only one parent can join the program? I would say at least one parent is required to be part of the program. So this is not something that you as a parent just drop off your child and then you just sit back and relax and do nothing and just relying on, okay, you just need to learn what to do and just do the thing. And I'm just going to be here. So let me know if you need me. You also need to be very, very actively involved as well. So if you are hoping that you can just drop off your child and you are totally out of the game or even stadium, then this is not a good fit for you. So again, it is really a team approach, and therefore the parents have to be the part of the solution. Also, another question: what if there's any psychiatric concerns, for their teen? So again, stress or trauma are not required to get the diagnosis of FND these days. So if your doctor has been insisting that this is the case, your child has a trauma that you need to find out. As long as you treat the trauma, the FND is going to be gone. Those days are gone. Long gone. So once again, because the Teen FND Academy is not a treatment or therapy, so any psychiatric concerns you may have or your teen might have will be handled by a mental health therapist, just like any other psychiatric concerns. Can I do it skill-wise and authority-wise and credential-wise? Oh, absolutely. This is what I do. However, in this particular setting, that is not my role. Okay. Once again, what Teen FND Academy can help you is to build the skills to rebalance the brain and the body, such as autonomic nervous system, by increasing really the self-awareness of how a teen is feeling in the body when she experiences an emotion, right? So many times teens with FND actually have a disconnect of their brain and the body. That's really what it is. So one of the things that we teach in my program is to increase the awareness. So not just the symptoms or the pain, but everything else. So really the teens are learning the bottom-up approach of becoming reconnected with their brain and the body. So some teens see their therapist while gaining the skills through my program. And as long as you guys are available and able to do both at the same time, logistically speaking, then that's totally fine. Because again, I am here as a guide and coach. And here is another question too. We as a parent are so interested in this is what we want to do. We know this is really helpful, but I don't know. My teen doesn't seem to be interested in. They think it's another online school like they did during the pandemic. Let me tell you, first of all, I get it. And let me also sort of coach you right now. If that is your teen's focus, then meaning I don't want to do anything related to online school or anything remotely close to it, then I can tell you the Teen FND Academy is not a good fit because it is an online program. But more importantly, here's why. Think about it. What is the priority here? Is your teen really wanting to get better from FND, or is your teen so stuck on how they want to get better? So if they have thousands of options and choices, sure, it is all their right? So at the end of the day, I want them to feel like they're in control, right? Because absolutely that is important. However, if this is more important than their desire to get better from FND, then can I say getting better from FND may not be their priority. And normally I would say the teens are not necessarily aware of that. They have something blocking, right? Yes, they want to get better from FND, but they feel like out of control because there are other things blocking. So part of the education and support that parents can help is for them to see those big picture, right? And then kind of talk to your teen about it, not in a way of nagging, no, you're wrong, focus on this, kind of thing. Then it really becomes a power struggle. But again, this perceptions and opinions about this online school, if I had to guess for your teen, is likely this one online school experience during this pandemic, right? Again, is that what they're basing off of and then generalizing it to all of the other online school or online learning, online whatever situations? But I bet you if your teen is likely watching something on YouTube or watching a video or TV or movie or something and they're learning something, then I would say the online learning environment is not the problem. It's more about what went with it during that pandemic time and online school and everything else. So it may not be the online school that is the problem. It may not be they were not ready and it was like everything was in shambles, right? Like nobody knew what they were doing back then, right? So those can be the reasons why. So what I'm saying is that your teen can be sort of generalizing and thinking black and white. And again, it's a brain thing. It's not the teenage thing. It's not just the FND thing. But that is something to think about. And then Teen FND Academy, just so you know, is not an online school. All right? Because I'm not really sure what that means exactly, but what the teens are learning is how to get better, really. So it's not like a school where they are graded, and then having compare to other peers and things like that. No, they're there for one reason, right? And so I am acting as a coach for teens who want to get better, and they rather focus on practicing the skills they learn. So yes, it is an online thing and it is an online education opportunity, but is it the same thing as online school? Well, it kind of depends. It's not really an online school because it's a coaching program. And we meet weekly for that matter, but I'm not really giving any lecture like a classroom, right? It is really about them taking the control because it's self-directed and they come to the call with questions and any sharing the wins and struggles and things like that. And then again, a little bit of coaching here, kind of back to the previous point of what is a priority here. I also want to put it out there. Where is this perception coming from? Right? I mean, like what is the real issue here? Like, is that it? The online program, the online school impression perception is not that great. Is that it? Is that the only thing that is blocking? Or is it actually the story that your teen has about something, right? And luckily in Teen FND Academy, in my program, we talk about what is a fact and what is a story. So, because again, this is super common thing. But at the end of the day, as long as the parents are super involved, then there is a chance. Because at the end of the day, really, if you're not involved, if you're not willing to invest your time and energy and really effort in helping your teen get better, then your teen has less and less likelihood of getting better on its own. And that being said, I'm not here to basically tell you whether you should come to my program or not. It is really about, do we have a good fit or not? And there are a lot of families who are applying and not quite qualifying because they are either not ready, or this is not their priority, or are expecting something completely different. Getting better from FND is a hard work. It's not that difficult. In fact, it's quite simple. But sometimes doing simple things isn't necessarily easy, right? That's why you and your teen have to be motivated enough to want to get better. And this is why starting with the mindset and then checking in, do you believe that FND is something that you will be having for the rest of your life? Therefore, you're just looking for someone to talk to, or just looking for tips here and there to cope with the symptoms. Then absolutely Teen FND Academy is not a good fit, because we are the mindset, and I have helped so many teens resolve the FND so they get their life back. So again, if this is what you want, this permanent disability band camp, then the right approach for you is to find a counselor who you can talk to. Right? So this is going back to what is the right approach. I'm not saying I am the only approach or the right approach for everybody. So again, know what your goal is and know what you're trying to get out of. And then really think about then what is the best way to get to what you want. Well, I hope this was helpful, and I am happy to leave a comment below, answer any questions. And if you believe that my program is a good fit for you, then absolutely click the link below to schedule a call to talk to me. Well, thank you so much for watching this video, and I will see you in the next video.